Dr. Ozan Sozer is a board-certified plastic surgeon. He has more than 20 years experience and is known as an innovator in his field. In addition to his practice, he also is very passionate about mentoring and training other surgeons, not only in the borderland, but across the globe. And here's the doctor joining us now. Thank you so much for being here with us. So I want to talk about your background. In addition to all the medical training, what else does it take to be a board-certified plastic surgeon?
Well, to become board certified in plastic surgery, first you have to finish the full plastic surgery training, and then you have to take a written test. Once you pass the written test, you wait 1 year because you have to accumulate cases, and you send a list of all the cases you performed during that 1 year, which is called, it is board eligible at that time, but you're not allowed to use that term. You cannot put it on your website. It's board eligible, so you don't say anything. And after 1 year, they review your cases and they decide if you can sit for an oral test, which is offered once a year. It's a 3-day procedure. Probably it was the worst 3 days of my life. And you basically go to a hotel, and there are professors from all over the United States, and considering we just graduated a year ago, they are like idols for us. And every day you go to one room. They give you cases, you review them, they ask you questions, and the questions are set in such a way that everything goes wrong. Okay, doctor, you did this, but all the incisions opened up. Always getting complicated, and they kind of cream you 3 days in a row. And after 3 days, at that time, they would let you know immediately. Now you have to wait for a month, then you can become a board-certified plastic surgeon.
And I'm just curious to know, how many years does it take for the medical training? How many years is that?
Now, pre-med is 4 years, medical school is 4 years, 8. Then you have to do some sort of other training at my time. So I did general surgery, which was 5 years. I became a general surgeon, so 13. And on top of it, I did 2 years of plastic surgery, 15, a year of microsurgery, 16. It took me 16 years.
That's a lot. Wow.
Then I waited 1 year to become board certified, 17 years.
Okay, so if anybody's watching this in El Paso interested in becoming a plastic surgeon, what advice do you have for them?
Well, they have to be really, it has to be something they really want. It is a big commitment, 17 years. And you will see all your friends in other specialties, not specialties, in other professions, graduating 20-something years old, starting to make money, and you are in the hospital taking call, working for minimal wage for 18, 17 years.
Right.
And they are buying cars, they are buying homes, and you can't do that. And it gets old actually after a while. I was 30-something years old when I graduated. So if you want that, you have to have that kind of commitment to do it.
Right, so you have to be very focused and determined.
Exactly.
Okay, and you have a lot of years of experience behind you. What made you land here in El Paso?
Oh, it's kind of a long story, but I studied medical school in Turkey. That's where I'm from. And after I finished medical school, I got accepted to University of Texas, Houston General Surgery. And I did my general surgery training there. Then in Houston, I did my plastic surgery where they invented the silicone breast implant. The first implant was put in by my professor. And, but I did it with a visa. It's called J1. J1 requires that you leave United States and go back to your country for 2 years, not anywhere else, your country. So I graduated, I got a letter from the government, I have 2 weeks to leave United States. I went back to Turkey, I spent my 2 years. Meanwhile, I got married with my current wife, who is a doctor, and we both had Texas medical license, and we wanted to come back to Texas. And hospitals over here, they offered us a position with some guaranteed income, which was quite a bit money for us at that time. And the rule was to stay in El Paso for 3 years. My wife was not too happy about it, and we said we stay 3 years, and we go somewhere else. It's been 20 years.
20 years?
20 years, yes.
Wow, so she grew to love it.
No, now she loves, she doesn't want to go anywhere else.
Yeah. So you travel the globe and you train surgeons, and surgeons have come here to El Paso to train under you. Why give back? Why share your expertise?
Okay. But when we say training, I have to clarify it. It is when they come over here, they don't operate. They observe.
Okay.
They cannot touch a patient in Texas, and but they get exposed to the surgeries where the patient allows the other physician to watch the surgery. We ask the patient, we get a consent, and usually 90% of the patients say yes for the other doctor to observe. When I'm doing the surgery, I show them the technique. If they have questions, I answer. This started so many years ago when I got invited to some conferences about some techniques I invented at that time. And I presented once and twice, and people start to come to me, well, can we come and visit you and see how you do it? Because listening to a talk is different than seeing the actual surgery. So 1, 2, I don't know how many people visited me, but it may be 50, 60 by now.
Wow. And you have a lot of certifications also in different areas, from plastic and reconstructive surgery to advanced cardiac life support. Why do you seek all these different certifications?
I think most of the doctors have similar certifications and qualifications. That makes you complete. I mean, yes, you know how to operate, but in a time of emergency, you have to do how to do a CPR and everything. So those certifications are important. And the more things you do, the more you learn, the more qualified you become.
Okay. And doctor, what happens if a patient comes in and is very nervous or has reservations about plastic surgery? How do you talk to them? How do you put them at ease?
The thing they are most anxious about is anesthesia. Like,
Yeah.
You know, doctor, I never had anesthesia. I hear people.
You hear a lot about stuff
waking
like
up
that,
and
yeah?
he said, actually, anesthesia is the best part of the surgery. It makes it pain-free, and in my office, my anesthesiologist is a full-time employee. She only works for us, so we have such a consistency in service. Every day, the same people give care, so it makes the service better, I think. But if you have an anesthesiologist and you're healthy, anesthesia has zero problems. I think I operated in my surgery center around 10,000 people in El Paso. We had zero problems with anesthesia. So I think that's a good track record.
So just talking with them. And
Yes, and also
them know.
sometimes they worry. It is important to be honest with the patients. Like if you come to me for a tummy tuck consultation, I never say, oh, come on, it's easy. I say, well, have you ever had a C-section? Yes, doctor. Well, it's 3 times worse than that.
Right.
I'm
Wow,
very honest.
That's
I'm
painful.
very honest.
Yeah.
You know, I said, I want you to be prepared.
Right.
You know, I want to make sure you're mentally prepared, and also make sure you have somebody at home staying with you, taking care of you. You will need these supplies. You know, just be prepared. Once you talk to them and they are mentally ready, it's not a big deal. But if you say it's nothing and then they feel like they've been hit by an 18-wheeler,
Right.
that's a shock.
Yeah. Okay. Well, I want to talk about this new thing that you have, this new facelift that you have.
Yes.
So you have innovated and refined a new method for facelifts without scarring. At least no scarring?
Well, some portions has no scarring.
Yes.
Some procedures have some.
Okay.
But they are very well hidden, and probably 1/3 of the scar that we place in a standard facelift, traditionally.
Okay.
So it shortens the scar. Like in a standard facelift, the scar may start from here, come this way, go back, and go down. So this is from here to there, it's this long.
So it's an incision?
It's an incision.
Okay.
It heals very nicely, it becomes kind of invisible. If I do a full facelift, instead of cutting from here to here, I will only cut only this much.
So a lot more minimal.
Minimal.
Right.
And I will do all this portion, to really not cut in here, not cut in here. And I don't, by keeping the incision shorter, I don't compromise from result. Actually, I truly believe the results are better. I just don't need the incisions anymore.
So you believe it's still as effective as
No,
honey?
it is not as effective. It is
Or
more effective.
It is more effective.
Yes.
Okay. And how have your patients responded to this?
One portion of the surgery is scary. I place what we call a surgical net. And if you show it to the patients, they're like, oh my God, because there are a bunch of sutures on their face from outside. But I keep them only 48 hours, only 2 days. That allows me not to use drains. Drains are tubes under the skin. They come out. I don't put any dressing. So my patients, if I do a full facelift, they wake up in the morning, they take a full shower, everything can get wet. And there are no bandages, no nothing. But there are all these sutures. To an untrained eye, or if you don't show a picture before, they're like, what did he do, you know? But that really complements my technique. And once you remove the sutures in 48 hours, it's gone anyways.
How do you come up with this? How did you develop it?
The surgical net was not my idea. Surgical net was Andre Arswald. He's from Brazil. He's a very good friend of mine. And but I took his idea. I think I took it a level higher. I applied it in other places. I used it not only, he puts it not to get any hematoma. Hematoma means blood collecting under the skin. So he puts those sutures and all the space is shut, the blood cannot accumulate. But I took that, to me, it is not the main benefit. I kind of move skin around and I secure it from outside to wherever I want. So I don't need an incision here to do that. So I took it to another level, and I communicate with Andre all the time. We have a chat, we talk to each other, and he started to adopt some of my new procedures. It's been a very good exchange of ideas. But now that procedure is becoming more popular. I was the first one to put the net in the United States. Now still handful, maybe 10, 15. But in the next few years, that 15 is gonna be 50, 60, and you're gonna hear, oh, here in my practice, you get the surgical net, you have the shorter incisions. It's gonna get there, but little at a time.
Wow, and it all started in El Paso.
Yes, kind of, yes.
Yeah, you brought it here to the U.S. So from your perspective, the patients that you talk with, how has it changed their lives? What do they tell you?
I mean, depending on the procedure. Are you talking about facelifts or?
Yes, since we're on this subject,
Yes.
particularly the facelifts, how it's not as intimidating, I think.
Yes, you know, you can take care of your body, is that right? You can exercise. Even if you have surgery, breast surgery or liposuction, yes, within your dress you look better, but you can do without them. If you just exercise, you're dressed all the time. Bikini season, you may not wear a bikini, but your face, you cannot hide. At least in this country, you know, in the Middle East it's different. But face is very important. People work longer nowadays because they live longer. Some ladies, most of my facelift, I guess 80% females, 20% males. And these ladies are professional. They know what they are doing. They have full energy. They exercise. But they say, you know, nowadays I don't get the respect because my face looks old. They think that I'm going to get tired fast. You know, I have this tired look. I don't have the energetic look another younger lady has. And so they come, I want this to change.
So they want their face to, I guess, reflect how they feel inside.
Exactly. It is not necessarily looking 30 years younger, but they want to look like sharp, energetic, fresh. And so I say, look, if you're going to have this surgery, you'll be in hiding 3 weeks. You understand that? Is that right? Your body is going to be just fine because your face looks kind of weird. You're going to be hiding. You're going to be bored at home because you're such an active lady. And they say, Doc, I'm ready for that. And at the end, even their demeanor when they come to my office is different. They are so happy, smiling. They don't have that angry, tired look. And it's been very positive.
Dr. Sozer, I want to see some pictures. Do you have
Sure.
some before and after pictures to show us?
Sure.
So if you can show us, and can you explain what you did in each photo to get the final results? You can show
Exactly.
us.
Okay, let's do that.
Okay. Dr. Sozer, so we're going to see some before and after photos. So if you can just explain to us what you did to achieve the final look.
Sure. Now let's look at this lady. She's around 60 years old. She's in great shape. This lady exercises every day and she's working actively. But her face doesn't reflect her energy level. Look, she looks tired and she's not looking full of energy. And look at this neck. We have wrinkles coming all the way to the shoulder, loose skin. This is her doing this. Think about when she's doing like a selfie in this position. This will just bulge out. And she hated when somebody took her pictures in this position. Her chin starts with the neck. There is really no neck, bunch of bulging skin. So she came to me and she said, look, doctor, my major concern is my neck, but also if you can improve, make me look more energetic, but I want no scars. I mean, I have to put some scars, but she wants no visible scars. Now, I did on her a short scar or hidden scar neck lift. In a standard neck lift, when I say standard, 99.9% of the practices in the United States, almost everybody, will put an incision starting from here, go to the back and come in here, another incision to correct the neck, okay? Her neck was done, as you can see, through a tiny incision here, and the other incision is very short behind the ear. No cuts here. She has no scars here. But look at this, all these wrinkles, even these are gone. And if we look at from the side, she has a perfect angle, and when she puts her neck down, there are no folds. Then we thought about correcting this area, just don't make look tired. So what I did is, I did a gliding brow lift. That's a brand new procedure. Again, in the United States, may be done in 4 or 5 practices. It was done through a tiny dot here.
A dot.
A dot. And all the skin was elevated and secured, and also I did fat grafting. Look, this is a kind of empty looking upper eyelid. It's missing volume, this fold over here. This is nice and full and youthful. Same under the eye. It's all volume is restored and no scars. You look at these ladies' face, nothing. But she looks like she had a facelift. She has no scars.
But it's not excessive, like you were saying. It's
It is not
pulled
excessive.
Back. It looks very natural.
Exactly.
Yeah.
It looks like now she's a go-getter. Over here, I'm tired. Here, I'm ready to go. That's the difference. And no scars, no overdone, not like going 100 miles an hour.
What did she say when she saw this? When she saw the comparison?
She is the happiest person. She's just like an Energizer bunny. Here is another patient, similar story. I don't want scars, but I want to look better and younger and more energetic. So when I look at her, she has a very full neck, maybe a little extra skin around the eyelids. The corner of the brow is kind of drooping. And so I said, if I can't make this skinny with my neck procedure, triangulate the face and do something around it, I don't need to do a facelift on this lady. I can make her look great. So let's look at her. Look how crisp this jawline is. And she has no visible scars the same way. And there is a line over here, that's the eyelid scar. And as you can see, I elevated the corner of the eyelid with a gliding brow lift, scar-free, a dot here. So this procedure was done, a dot here, a line here, tiny bitty line here, and tiny bitty line behind the ear. No other incisions. And I think she looks younger. Let's go to another view of her face. When I say almost a perfect neck, this is it. This is technically very difficult because she was born, there is certain structures over here, a bone, the breathing pipe and other things. In her case, she was born there a little bit in the front. She could never have a beautiful, perfect angle like Angelina Jolie or like yours. And so we had to push all those structures back and create this structure. But look at her. You see a scar here?
Can't see
Nothing.
anything, yeah.
A scar here? Nothing. Can you see a scar here? Nothing. So almost scar-free. This procedure was done almost scar-free. Men, absolutely they don't want scars. And most of the men, they come to you, they really don't want a facelift. They are bothered with their neck. They say, "Doc, do something to my neck. I don't want to have a facelift. I'm fine with my face and maybe something around here." But this gentleman is bald. I have no place to put incisions anyways.
Oh, because it's usually hidden by the
Yeah,
hair,
I mean, most of the brow lift type of procedure is an incision here. So, and it is hidden in the hair, but she doesn't have hair. So I did, so look at this kind of drooping over here. I did, again, to a dot, somewhere around here, this surgery. Elevated. There is a still hint of it, but nothing like this.
Does that add, having that there, it makes it more natural? Is that why it's not like, again, excessive,
exactly,
right?
and also it is like we're not pulling and cutting this,
Right.
and just we're shifting tissues to where they were before. And the neck, again, she said, "Don't cut me here, please. You know, I don't want. If you're gonna cut there, I would have had a facelift. So just fix my neck." So a lot of loose skin. We fixed the neck. He has an incision hidden behind the ear, so nothing in the front. You see him? His friends were trying to figure out what happened to him. Everybody's looking to his ear, trying to find the scar. There is none.
Yeah.
So he used a miracle cream. That's what he says. But yes, you see, you cannot see the Adam's apple. Now he has a very nice, more masculine look. His Adam's apple, again, no scars. The only scar he has is like tucked in, right in here.
Is it difficult to do it with an Adam's apple? You know how you were saying when it kind of protrudes?
Not really. You know, man has Adam's apple, and
So it's
if you
not-
make an Adam's apple in a woman, it's not cool.
Okay, and you can again see the chin, right? The shape
Exactly.
of the chin.
And I didn't do a chin implant, nothing.
Wow.
I just used whatever he had. It's a matter of creating an angle. So I have to bring these things, this structure like this. So all of a sudden, he has a chin. This is a more involved procedure. So she was an older lady. She wanted to look younger, and we had to do a facelift, including eyelid surgery. So remove the excess skin from the upper eyelid. These bags are removed through a tiny incision inside the eye, so we don't need to cut here. Of course, she does have an incision here, as you see. That's a facelift incision, but it is short. So you see, it starts from here and ends. It doesn't come up to here. And the neck, we cannot really see part of the neck in this photo, but I'm going to show one more view. I think it's much more drastic than this. So it is very important. In my office, before surgery, I take patient's photo in this position, because that position will judge if your result is almost perfect or not. Because everybody looks kind of decent like this, but when you're like this, it's a very humbling view, and you cannot hide anything. So I take a picture, and look, all this hanging skin. And if you do a real good job to restructure in this area, at the end it should look like this.
And that was no chin implant. It's
No
just
chin
that you-
implant,
yeah.
no nothing. This lady is over 70 years old. And this is how many years old? 70-year-old people don't have a neck like this. And even in this position. So that's very important. All this is corrected. So that's how you judge a result, because when you look at an internet before and after, you'll see like there is a before and the after is like from a certain angle. I guess they pick and choose where the patient looks the best. This is the angle everybody looks the worst. So try to see how the result looks in this angle. Here is another one. A lady has all the signs of aging, looking tired, kind of looking angry, and has the loose skin you can see in the neck, bags under the eyes, bags and loose skin around the eyes. And also, as we age, our upper lip gets longer. And as you see, this is a long upper lip. A long upper lip is not pleasant. Really, it doesn't look sexy or younger. So I did what we call an upper lip shortening. The incision is hidden inside the nose. As you see now, this is a youthful length. This is too long.
And it eliminates, I guess, some of the
yes, and also
wrinkling
it restores the lip volume, because as the lip comes down, it does this. When you shorten it, it comes up. So look at that lip and look at that lip. No injections, just a lip shortening. Of course, upper eyelid, those bags are gone. The scarless brow lift, facelift, and a neck lift. Now you can see these are corrected, which she doesn't have it. And when you see, this is a very crisp contour. Let's look at it from the side.
And it even looks like she has more cheekbone also. It made that stand out.
That's fat grafting.
Oh,
I take
okay.
their own fat and graft it. And also when you shift things up, it looks a little bit more cheeky. Yes, a little bit more volume there. Because now, this is called lower eyelid to cheek transition. As you see, as we age, we develop this line. So, and this tissue comes down and creates this line. So it's kind of a droopy, not so pleasant transition from the lower eyelid to the cheek. But if you look over here, you see this distance from the lower eyelid to this point is long, almost close to an inch. Now look at it. This is like 1/3 of an inch. Young people have like this. Old people have like this. So the younger lower eyelid to cheek transition is restored. Empty upper eyelid, youthful upper eyelid. Let's look at this neck contour. I mean,
You see the jawline.
Yes, she has all the definition in the world. And let's look at her in the humbling view.
Because like you said, nobody looks good.
Exactly. Look at the difference.
Yeah.
I mean, in the other shots, you didn't think that her neck was so bad, but look at this. There is no neck. And now,
yeah, you can see.
exactly.
Definition.
So this is the humbling view. If the neck is done very well, it should be looking like this in this view. And all these wrinkles, as you see, we didn't do lasers, we didn't do anything. This was all corrected during her surgery.
Okay. And doctor, I know a lot of people watching at home, they have this question of how much does this cost?
It depends on the combination.
Right.
Like if I'm doing just this and this, I don't know, it depends. 9,000, 10,000. Full eyelids and everything face, it can go up to over $15,000. These ladies were generous to give consent to me to use their photos. So there is a reward for that. So I cut the price down for them. If you're not so private and say, Doc, you can use my photos on KTSM and there will be a cheaper price.
But for that, the innovative facelift, the minimal, how much is that specifically? Or does it just depend?
It depends on the combination,
Okay.
yes. Like if the patient is a little bit younger, I don't have to do as much, it's cheaper.
Okay.
None of my patients gave consent. I have less than 30-year-old girls. They are born not so perfect necks. When they do this, I mean, and they wanna, nowadays it's very popular to have this crisp jawline and everything. I operate on them, I promise their neck look like Angelina Jolie. But technically for me it was very easy and I finished it in such a short amount of time. It was cheap, 5,000, 6,000.
Right.
Okay, I mean this one is over $10,000 because yes, because I'm doing so much.
Right. And if someone's interested in these procedures, a potential client wants to reach out to you, how do they get in touch with you?
Well, our office number is 915-351-1116. They can go to our website, elpasoplasticsurgery.com. I think I have all of them. I have elpasoplasticsurgery.com, elpasocosmeticsurgery.com, elpasoaestheticsurgery.com. I bought those domains 20 years ago. I guess it was a good idea.
So you have all those. Okay,
all
or they
those,
can
yes.
Google and find you that way.
They put El Paso Cosmetic Surgery, El Paso Plastic Surgery, it comes up. They can put my name, Sozer, S-O-Z-E-R, I will come up.
Okay, Dr. Sozer, thank you so much
My
for
pleasure.
sharing everything, the results and everything with us. We really appreciate you being here with us.
Thank you very much.